My name is Dr. Michael Head, and I'm a Senior Research Fellow here in the Clinical Informatics Research Unit at the University of Southampton. So my background is in global health. I qualified in epidemiology, and a lot of my research is focused in Ghana in West Africa, with recently some research in Ukraine as well, looking at the health needs of Ukrainian refugees and displaced populations. With the research in Ghana, we've turned a lot to COVID-19 research over the last couple of years, of course, and a lot of that has involved work around vaccine hesitancy and knowledge, attitudes and practice of the Ghanaian populations towards what they perceive COVID-19 to be, how much of a threat. So some of the research has taken place in rural Ghana. We did some in-person surveys there where we trained local community volunteers to use some electronic devices and carry out surveys around their own populations about how their fellow residents perceive COVID-19 vaccines and whether they would accept one or not. So we've used that evidence to push it towards policymakers in Ghana, but also policymakers outside of the country as well, such as at the World Health Organization. So, for example, with the Ukrainian health needs study that we set up in a hurry earlier on this year after the Russian invasion of Ukraine. So we've collected data from people who were displaced within their own country or are refugees outside of their country. We've got data on, for example, what chronic diseases they have, like do they have diabetes or tuberculosis or asthma, if they need medication or not, if they have access to healthcare, those sorts of questions. That's all really useful information for the response teams who are on the ground with the refugees, but also for organisations like the World Health Organization. So we're in touch with the response team at the WHO headquarters in Geneva, and they're using our data to inform their policy and planning, particularly in countries where the WHO have offices, which includes Poland, Romania, Czech Republic, and so on. Where there's refugees in those countries, they're using the data that we get to help set out their policies for how they should respond to the Ukrainian refugee crisis. So with Ghana, for example, I spent a lot of time building up relationships with colleagues across the Ghana Health Service and the Ministry of Health and other stakeholders at district levels within the health service, regional and also national level as well. So we get insight into their priorities at different levels across the health service. I've been to visit them in person several times, and certainly the Ghanaians are very big on in-person contact. They like to actually meet you and see the whites of your eyes just to sort of get an idea, and that builds up long-term trust. So when it comes to developing new research ideas, we're working very closely with them to see what they would like to happen. We're not going to impose our ideas upon them. And by including them at all stages of the research, when we produce some research results, we not only have a network of contacts ready to receive them, but we're also a trusted resource. So with our vaccine hesitancy work, we are really the go-to team with the Ghana Health Service in terms of vaccine hesitancy data. And our data has, for example, been translated into a training manual for community workers, particularly health workers, so they can engage their communities to improve vaccine confidence and to answer concerns that they have. And a lot of that is based upon the data that we've collected across the pandemic. So there's a few different kind of forms of dissemination, which includes writing policy briefs, which are useful for sort of senior people in the Ghana Health Service, for example. But also across the pandemic, I've done a lot of work with the media, both here in the UK and abroad, and also in Ghana as well, in fact. That gives you a big public audience. And clearly the media can and does drive policy narrative, sometimes for good reasons and sometimes for not. But across the pandemic, for example, with vaccines, I think it was really important to get the media on side with the importance of vaccination. So that did translate into sort of policy impact as well, where the Department of Health here in the UK and other ministries of health abroad were fully understanding that they really needed to prioritise the COVID vaccine programme. And I think myself and other Southampton and, of course, external colleagues appearing on the news to talk about vaccines has had a big impact in terms of reinforcing what the public messages need to be around handling the pandemic. So overall, it's been a very, very positive and beneficial experience for me dealing with the media. At the start of the pandemic, our media relations team came to me and essentially said, you know a bit about infectious diseases, don't you? If this outbreak that's starting off in China becomes big news, do you want the media to contact you? So I said, all right, then yes, because they occasionally ask me that sort of question and the story goes away in the day and I never hear from them. And then clearly 3 years later, here we are, and I've done dozens of TV interviews and radio interviews and given hundreds of quotes to the newspapers. So it's been quite an intense time. Early on, I was getting in the swing of it. I didn't quite really know how the media worked. but some of the early interviews went quite well. I was very nervous that they might try and deliberately trip me up, but actually they were saving the trippy-uppy questions for the politicians and not the scientists. Really, the media want to keep their experts on side because they will want to come back to you time and time again. So on the whole, they're not there to trip you up. They are literally there to pick your brains and to learn from you. So from that point of view, it has been positive. Again, it's important to get the scientific messaging out there. We've had experiences in years gone by here in the UK with the MMR vaccine and Andrew Wakefield sort of scandal, essentially, when, amongst many things, the media repeated Wakefield's narrative and us scientists weren't so good at responding to that and to put the correct messages out there. I think there were a few points across the pandemic, actually, where fringe scientists promoted alternative views that were not the right views. For example, with something called the Great Barrington Declaration, which essentially involved people mixing very early in the pandemic, which would not have been a good idea. And us scientists and authorities like the WHO came out against it. That framed the media narrative as well, so it did sort of dampen those fringe views. The consensus held firm there, and getting that into the public narrative was important. So, yeah, my public experience with the dealing with the media, on the whole, very good, and I certainly would encourage other academics to get involved as and when their expertise is in the news. So PPS has genuinely been a really, really useful resource for us to use here at Southampton. So my research is more towards the sort of the public health implementation end of the spectrum. So I do wish to deal directly with policymakers. So when I arrived at Southampton, I did come on many of the PPS training courses, which were very helpful, and also just speaking to the PPS team at the time. So we wanted to engage with colleagues in Brussels, for example, at the EU. And PPS had a sort of a ready-made list of people to contact, and even things like when the European Commission was busy, or when there's public holidays in Belgium and things like that. So we knew when to go out, who to contact, and how to make our research at the time most impactful. So that was very helpful. We've also won one or two small grants from PPS over time as well, which has given us a bit of personal time to focus on the policy side of things, and also travel as well. So we've been to Brussels, as I said. We've also been to Geneva, to meet with WHO colleagues there. And we've also had meetings in London as well at the Wellcome Trust, on the back of some PPS funding. So all of that combined has been really, really helpful to help us engage with policymakers, find out who they are, and a little bit on the nitty-gritty of actually how to deal with them and how to approach them. For example, producing policy briefs rather than sending them journal papers, because no one's got time to read 3,000 words, whereas maybe they might read 1 or 2 pages of sort of policy-friendly writing. So I think all of those reasons combined are why other academics should look to engage with PPS if they possibly can, and why my research certainly has benefited from doing so. So one of the reasons to engage with policymakers is to increase the impact of your research. If you're spending months or years doing a project, you want it to mean something and to do something at the end. You don't just want to write a journal paper and then forget all about it. You want the results to be used. So clearly engaging with sort of colleagues in UK Department of Health, for example, or in my case, the Ghana Health Service or the Ministry of Health there, your research results will be taken up and absorbed and read by the people who can make change. And that's really what it's all about for me, is to make positive impact in my own areas of expertise and in my own research. So I think I would encourage academics to look at engaging with policymakers and to reach out to myself if they wish. I'm happy to pass on tips, but also to PPS, who of course have this in-house expertise, so they can pass on their own kind of knowledge and experiences to yourselves when it comes to working with policymakers in the future. So I would add actually that policy engagement is for people at all levels of seniority, whether you are junior, an early career researcher, or whether you are a senior professor. You don't have to be very experienced to be able to approach policymakers. If you've got some interesting findings, then they'll be happy to receive them and want to talk to you about it. So even if you are an early career researcher who's new to this, again, I would encourage you to look at policy impact as part of your research, because it will help you and potentially help do some public good with your results as well.